First of all, in the name of Allah, I am Suwareldahab El Noor. I'm a registrar of medicine in Ahmed Qasim Teaching Hospital in Sudan. It is a cardiac and surgical center. We hear about this Medicover Hospital from my consultant, is a consultant interventional cardiologist, Dr. Samuel, and have a unit in Ahmed Qasim Teaching Hospital. And some of his colleagues getting training in this hospital and became a competent interventional cardiologist working in Saudi Arabia and different countries. He recommended this hospital for TAVR for my father. This is my father, Suwareldahab El Noor. He is 82 years old man, diabetic and hypertensive, and have several complications, and cannot easily undergo to a open cardiac surgery. So he recommended that for him this procedure, which is TAVR. And he recommend also Dr. Sharath, because he is we here there in Sudan, he is a competent in this procedure and underwent several times procedure. Maybe 2 times per week he exposed to this procedure. There is several countries doing this procedure, but we choose this country because the exposure is very high here in Medicover Hospital, and the center is very qualified with a very competent staff and cath labs. During the procedure, firstly, I attend this procedure by myself. They permit for me to attend it through the consult room. Really, it was amazing for me because the staff was big staff. There was at least 4 interventional cardiologists attend this procedure, at least. I don't know what is the number, but I think that it was 4 at least, because all these 4, I know them very well. They was interventional cardiologists, and also anesthesia staff, very competent. Electrophysiology cardiologist was attend, and even the the thoracic cardiac surgeon also was attend this procedure. The procedure underwent easily without anesthesia, and even the doctor was not use contrast for my father because he had a kidney problem. He used very minimum amount of contrast, the least amount of contrast. During the procedure, my father was aware about the procedure. They said they wasn't use anesthesia, and after that, immediately he brought to ICU. Amazing thing that the ICU is multidisciplinary ICU. It's not an ordinary ICU. Stayed there in the ICU about 24 hours. Yes, just under observation, and they detect that he developed a heart block. With one of the complications of this procedure, but they was, as I said, aware there is no something wrong without complications, as we know in medicine. It was suspected, highly suspected, regarding to his age and comorbidities. He underwent also another procedure, Pacemaker, and this procedure make it for him Dr. Nerian Kumar. After that, he stayed also 24 hours again under observation, and he retained to his activities and full recover after 2 days of this procedure, and now he planning for traveling after 72 hours just procedure. I recommend this procedure for any patient cannot go to open cardiac surgery. The hospital here is multidisciplinary hospital. My father here, several consultant of chest consultant, diabetologist, and gastroenterologist, they came for my father regularly for follow-up. Very nice cooperative staff. I recommend this hospital for patients of my country. I hope that from him to come here to this hospital because it's very nice and very competent center.